Welcome everyone to the Diversity and Ability and NHS Employers Inclusive Conversations podcast. In this second episode in the series on the topic of demystifying workplace adjustments. In the first episode, we talked about workplace adjustments, what they are, why they're important. And in this second episode, we explore how to request workplace adjustments, how to implement a centralized budget, along with some of the barriers and benefits. I'm Roxanne Steel, Accessibility and Inclusion Specialist for Diversity and Ability, also known as DNA, and with me is Lydia from Barts Health, NHS Trust, and Angela Peake from North Staffordshire Combined Healthcare NHS Trust. Thank you for listening, and we hope you enjoy our inclusive conversation. So, the first question is, how can someone apply for a workplace adjustment? What is the process and what should employees expect? Is there a standard?
Not in my knowledge, there's no standard, and that can change from one working environment to the next within the same organisation. I think it will very much depend on the individual manager. So always start with your direct line manager. Always start with that conversation with them. And the hope would be that the ball can start to roll from there. And often it will just be that conversation with them and how you interact with them and the team. So it doesn't necessarily go any further than that. But if it is a requirement for tech, maybe that needs to go onto your systems. Maybe you've used tech previously and then you would like to come onto your system. But if you're working within the NHS, that may be a big challenge because of the firewalls and different things. So if your organisation have a team of people that you know that you can contact, we've got a brilliant guy at Combined who I happen to find, and now he's just sick of hearing from me because I'm just like, can you do this, Dave? Can you do that? But it's really helped them as digital transformational team to really understand the needs of our disabled staff and understanding again what a disability is. You know, that people are highly, highly intelligent, but if you're dyslexic, then you require certain things. So yes, it's knowing who to turn to. So start with your manager. What to expect? Ideally, they listen and they actually implement what you require. That's the ideal scenario. Start with your manager. Go from there, and see what they have to say first.
Thank you very much for that, Angela. If, for example, and I completely understand your advice around going to your line manager first, what if you don't feel enabled to go to your line manager? Whether this be as a new starter or as someone just within the organisation?
Yeah, so I would always say find the person you feel really comfortable with, that you're happy to disclose to if you've not disclosed to people that you have a disability, that you feel comfortable to start that initial conversation. And that sometimes can be a senior manager, it can be sometimes maybe somebody on your own level. But if you're going then to seek support from different people within the organisation, you've got somebody there to support you. So find that person, find that buddy. If there's no buddy scheme, find that buddy, somebody that you connect with. And then you can always contact human resources. So HR within your areas, you should have a HR person that will be in your area that will understand the policies, that will understand the procedures, will help and support the manager to put what's required in place. You've always got occupational health. And I think there's a bit of a fear about occupational health. It's like, oh, well, but, I'm being referred to occupational health. That's never a good thing. I always think occupational health's great because it really gives you an opportunity to have a conversation with somebody who's not within your workplace to really discuss what your needs are. And they're there for you. They can then put a report together that can really help to to then take to a manager and say, well, these are the reasons why we're needed, that I need what I do. And it's backed up by the occupational health team. You've also got the equality, diversity and inclusion teams within your organisation, and your networks. They're always a brilliant place to go to. So if you've got disability networks within your organisation, then they're always a really good place to go, because often people have had the same challenges.
I think it reminds me of the old saying, it's not what you know, it's who you know. And I think I definitely agree with that when kind of accessing support. And I say unfortunately, because I think it is unfortunate, because I don't think you should need to be an expert in these spaces, especially acknowledging that on average, we will spend 13 years of our lives facing a level of disablement, whether that be kind of permanently, like myself, or even through a temporary accident, for example, or an acquired disability. I think it's really important to remember that disability looks so different. So I think that is also really important. You were talking about networks. What networks are in place for disabled staff at your organisation? And when I say disabled as well, I do mean disabled and neurodiverse, but of course, any intersectional networks that there may be.
So we have the Combined Ability Network, it's called, and they're just a brilliant group of people. And the lead of that at the moment is Deb, and she's absolutely phenomenal. She pulls people together brilliantly, is a real great advocate. And that encompasses all disability, neurodiversity as well. There was, before I came to Combined, there was a separate neurodiversity, but then we brought it together. And one of the really nice things is that we have Teams chats. So we'll have regular meetings, but in between, because many people can't make the regular meetings, that people will post things and ask questions and that in Teams chats. And all sorts of people answer. And, the really interesting thing is, somebody wrote one time, and I've learned so much about neurodiversity because of the Teams chats that I wouldn't have known, and it's really helped me in my workplace. So you never know what impact that has on people. So sharing support, information, it's a really lovely place to be. And I think what's really important about networks is that we have the input from our senior teams. So our networks are actually sponsored by a board level member. And so I think that is really, really important, that they hear what's needed for people, but also that that staff also have the ability to have conversations without them there, because it can often be a little bit intimidating if somebody from board levels there listening in. And I'm not saying that in a bad way. I think, they use what they hear in a really positive way, but some people do not feel confident to speak. But I think it's really important to have those links to be able to do that. And different people from our organisation have gone and spoke to the board because they have that ability, they're invited to different sessions. So there's real movement through what happens in the network to what can change within the organisation. And I think that's really vitally important. And I don't know if that used to happen in the past, but it feels like there's a real movement that now for all of the networks, that they are really linked to the higher levels in the organisation. So their message gets out there.
Amazing. So a really good call to action there. Go and find your networks, go and support them, because if that movement's happening, can you be part of the echo? Can you be part of that support? Absolutely. Go and find your networks. We spoke about this before, so probably quite briefly, you did mention health passports. Could you just give us an overview of what a health passport is and how an employee can actually access one?
Different organisations will potentially have their own health passports that they'll have developed. Within Combined, we use the NHS health passport. So if you just Google NHS staff health passport, it's an NHS employee's document, and you'll find it quite easily. It looks a very simple document to use, But I think if it's used wisely, then, and that was part of the training that I did, was to help people to complete the passport, because it's asking about all aspects of your life, really. And I would always say to people, do 2 passports. Do one which is your utopian workplace, where you get everything that you need, and you're able to speak to everybody, and you get everything that you want. And then one that you're willing to share, and that will change over time, I'm very sure. But some people are very afraid of sharing their stories and their needs. So do one that feels comfortable for you, that you're willing to share. For me, it's very important that passport is yours to keep, and it's not a document that you hand over to somebody else to look after for you. It's yours. It's your document. It's yours to choose what you do with that and who you share that with. But if you're a manager in your organisation and the health passport is part of your organisation, and you're not seeing people use that, then I would be asking the question, why? Or is there a fear of using passport? Are people afraid of saying that they have a disability? So the passports are really, really helpful documents. And it just breaks down the technology maybe that you require, how you want to be communicated with. And often we don't even think about that. We just know what works for us, but we don't think about how we can help others to understand that better. I have hearing loss. And within these sorts of situations, it's absolutely fine. But if I'm in a busy office and somebody's speaking to me and I can't see them, then I actually don't know that they're speaking to me until maybe the rest of the team are laughing because, they're shouting at me and I'm still not hearing them. Now, that for me, that's okay. That's not a problem. But for some people to have others laughing because they can't hear can be really disconcerting and really make them feel as if they don't want to be in that workplace. And so, if for other people to understand how they need to communicate with you is really important. So I would say to people, if you need to speak to me, you need to contact me, get my attention, then make sure I can see you, make sure you're looking and I'm looking at you, and make sure that you're not standing on my right-hand side, because I'm completely deaf on that side and everything I hear is from the left. So come to my left and speak to me from there. And then once people know that, they get all of it, oh, I'd forgotten, sorry, and then they come and they do it the way, then they can communicate with me. But enabling people to understand that helps everybody. And also it makes you feel a lot better, a lot more empowered and not disempowered by the way people respond in your workplaces. So using that health passport and understanding yourself is one of the most vital things for me.
Absolutely, absolutely. I couldn't agree more. I haven't used the NHS passport, but I have used DNA's very own passport, and that's been very enabling for me. Like you say, it's my information, it's my responsibility, but it's also my right to say, actually, I don't want to share that, because it comes back to that stigma and that understanding around disability. So thank you very much for sharing that. Again, after this podcast, I will keep saying after, because I don't want anyone to run away too quickly. Do Google the NHS passport, download it, have a look. Even if you're a respective talent person that wants to apply for a job, maybe having a look at what that passport looks like will give you an insight into how the NHS can support you. So I think that's really great. But before we go on to the final topic or main topic of the podcast, I think we can't leave out one of the most important questions, I think, in my mind. Lydia touched on it before. Access to work, something I like to call affectionately, and I will say affectionately, the government's best kept secret. Well, we're going to blow the lid on that secret and let people know what access to work is. So, Angela, again, over to you. What is access to work, and is it available to employees? Is it something to do with the NHS? I've probably given that away in my intro.
No, it's not to do with the NHS. It's a government-funded grant to help pay for practical support within work. And it is available to people that have a disability. You don't have to have a diagnosis, but, when you look at the term disability and the Equality Act, it's something that affects you on a daily basis and has affected you for over 12 months. So if it's affecting you on a daily basis and it's a challenge that you are living with, then you are very likely be able to get support from Access to Work. Dependent on your needs will depend on what Access to Work will give you. But there's a lot of money available for some individuals because that's what they require. But on the whole, it's often being able to get equipment that really supports you within your workplace. If the organisations themselves, dependent on the size of them, will need to pay a contribution towards Access to Work, and within the NHS, their answer is always yes. Will we do that? The answer is yes. So if you've got somebody that maybe requires a bespoke chair for them to sit and do the work that they do, and they can cost thousands upon thousands of pounds. And as an employer, it's like, am I going to employ somebody that's going to cost me those sorts of things to ensure that they get what they need? Well, through Access to Work, the employer only pays a minimal amount towards those, and there's set amounts dependent on the numbers of staff that they employ. So yes, it gives the opportunity for that individual to have the chair that they require or the tech they require. When you were talking about the Dragon medical software, a lot more expensive than the Dragon standard software because it uses all the terminology that you may use in healthcare. So consequently, it's a lot more expensive. So if you are able to get hold of that because you have an Access to Work grant, then that is brilliant because you can get what you need to ensure that you can do the job and have a level playing field. It's not giving you extra. It's not giving you stuff that, is going to make you absolutely phenomenal. It gives you a level playing field and it supports you to ensure that you can do your role equally compared to somebody who doesn't have a disability. The challenges that we have with Access to Work is currently it's about 8 to 9 months before people are actually getting some responses. So that, Roxanne, that message is getting out there now compared to what it was. But unfortunately, then Access to Work are taking much longer to be able to answer all the queries and answer the people that need the support. But to be able to apply for that, it's a government website. So if you go to the government website, you just Google Access to Work. And the application form used to be very, very simple, but they've made it a little bit more detailed. So if you need support, there is a lot of support out there to be able to get Access to Work in the first place. So don't be afraid of asking for help to be able to just fill those initial documents in. The grant, it's a grant. It doesn't have to be paid back. They will tell you what you're able to get. And then dependent on the organisation, that can sometimes be the challenge, being able to get the equipment that you've been provided with, getting that and then getting it implemented within your organisation. And that's sometimes they've got a very slick process for that. But it will very, very much depend on the organisation that you're in. So for me, with us now at Combined, we've got a team that is saying, okay, if we've got somebody who's got Access to Work stuff, they know that they need to look at that immediately to get it onto the systems as soon as possible so they can use it. So if you're using Dragon or multiple other software that you may have been given, then you need that support. And that sometimes can be a real challenge, and managers, again, don't know necessarily where to go. So if you've got that streamlining within your organisation, that's a phenomenal thing to have.
Again, it's probably a case of not what you know, but who you know. So again, that person that knows everything about Access to Work. So yes, in regards to access to work, I have to be an advocate in this space, and I have to say, do you know what? Without access to work, I wouldn't be here today to be able to present this podcast, down from the table that I'm able to use, the input software that I am utilizing, and even having a PA to enable me to actually be able to join this conversation today. And that is all thanks to access to work. I think we need to go on to our final topic, which is around centralized budgets. And I'm really excited, Lydia. From my understanding, Barts Health was one of the first trusts in the company to implement a centralized budget for those workplace adjustments that we've been discussing. Would you like to tell us more about that? More about your experience, essentially kind of the benefits that you've seen and some of the challenges that you faced? Over to you, Lydia.
Oh, hi. Yeah. So the centralized budget was formed back in 2017, I think. It's been a long time ago. It went through, so being the former co-chair of our network, disability network, Barts Ability were asked by the non-exec board to attend and do a presentation. And then from there, we had to explain what we needed. So they asked us, how can they help us to be able to support our colleagues who have a disability and to help them remove the barriers? So I explained to them what was needed, for example, the equipment for colleagues, and being able to have that for the department as well. So our network at the time held 4 listening into action events across our 4 sites, and we engaged with our colleagues to get their feedback and information. And one of them was to be able to have equipment put into place. And that's how the centralised funding came about. So we do have support from our boards. So we have several boards. So we have our non-exec board and we have our inclusion board and various different boards. So it had to go through that process in order for it to be signed off. I think a business case was put together for that, and the turnaround time for that was roughly about 2 years, but also linking it in with the WEDES as well and how we presented our data. We also work with our employee wellbeing service, which is occupational health. And at first that was a bit challenging, but now we have our links with them in a way of having a focus group each month to discuss any obstacles or issues that come through. And the challenges that we do have are that managers understanding that they don't have to use their budget to get the workplace adjustments put into place. So it's about giving them the information. And working with finance and procurement, that was really difficult. But we're still working on that as well. And ICT, because there's certain equipment or software that we are unable to use. And the learning from implementing the budget, we have our workplace adjustments focus group, as I mentioned before, and we work closely with OH that we do need a disability policy where workplace adjustments process are needed to support for managers to be able to assist our colleagues with the workplace adjustments.
Amazing stuff. What is, just one line maybe, what is the advice that you give to anyone listening that's chomping at the bit to get a centralised budget put in place at their organisation? Just one bit of advice.
One bit of advice, get your exec boards, your exec sponsors as well on board with this, because it does help, because we collect the data and we can see from our data that there is a need for the centralised budget.
So really backing that up with data.
Yes, definitely. Data is a big major part of this.
Amazing stuff. Honestly, wow. Thank you to both of you. I've been so grateful and so privileged to be part of this kind of conversation. But I would love to just pass over to you for 2 seconds, Angela, and kind of, could you give me your final kind of thoughts, Jerry Springer style? What advice would you give a disabled employee considering applying for workplace adjustment?
I would say know what you need before you take that step forward, or have an understanding of your needs that you can then have a two-way conversation with your manager to ensure that they can support you in those things. And that's where the workplace adjustments start to come from. If you don't know what you need, then others are going to tell you what you need, and it may not be what's right for you, because we're all so very different. So there is no blanket of what anybody needs dependent on the disability. You give them this, that and the other. It's if you know what you need, then you can empower yourself to be able to ask for the support and get it to ensure that you can do your job to the best of your ability.
Absolutely, absolutely. I couldn't agree more. Angela or Lydia, any final words?
Yes, ask for help and don't be afraid of asking for it, because there is always help. And do your health passport as well.
Accessing support is something everyone deserves. It is something that you are legally entitled to. And again, it shouldn't matter, but it makes good business sense, and it is going to support yourselves, your patients, and anyone that you will be working with. So again, I couldn't agree more. Thank you, Angela and Lydia, for this fantastic, inclusive conversation. And thank you to our listeners. We hope you find this podcast helpful, and you can access further guidance and resources on this topic via the NHS Employers and Diversity and Abilities website.